In today's video, the agenda is to practice those 15 NCLEX RN domains, and here is a NCLEX Next Gen NCLEX case study based on the patient Mr. Green from our textbook. This case study is designed to walk you through the entire clinical judgment measurement model in order. So this case study, Mr. Green unfolding case, the patient profile. So it's 56-year-old male, admitted diagnosis liver failure, cirrhosis. We have 6 questions on this case study, and 15 questions on the 4 major liver disorder. Use timestamp to practice what interests you. So now let's get started.
Hi friends, I'm Nurse Mia. Welcome back to my channel and to part 3 of the MedSurg RN chapter NCLEX review in the Zen RN study group series. In this video, we are breaking down the 15 NCLEX clinical judgment domains and showing exactly how they connect to the MedSurg chapter you are already studying. We will walk through each one step by step so you can finally see how NCLEX thinks and how to answer them. If you are being overwhelmed and unsure what the NCLEX really wants from you, this might be the missing piece.
Chapter 59, Hepatic Disorders Summary. This slide I presented in outline part 2. If you want to know more about this chapter, then you can go and watch the video I presented for this chapter. It's not that long, it's about 15 minutes, but you can use the timestamp to see where you want to review the disorders. If you are interested in more nursing documentation report, words, medical terminology for hepatic disorders, I have the part 1 and I explain what the medical terminology for chapter 59. If you are interested on terminology, then you can look there. I have a flashcard presented and a lot of key terms, all key terms there, and with picture, and I categorize them like anatomy, physiology, condition, by signs and symptoms, surgery, lab and diagnostic, all terminology that they are for chapter 59, they're all nice categorized. Here we going to go by those 15 domains. I have a case study from this last part, and for this basic care and conform 9%, keep in mind that select all the apply can be mix and match. So one can be, let's say one select all apply, 3 are correct or 4, then might be one of them basic care and comfort, and keep in mind it's 9%. If you miss that opportunity to answer, then it's a little bit we'll show, I think, in the next one a easier, same a basic care and comfort, but I will give some example what means basic care and comfort, especially by chapter 59, in case you have a case study for hepatic disorder, patients with hepatic disorders. So we go for more examples and practice questions for all of these. So one of each, just to kind of see how looks like. As you see, this page, the safety and infection control, is from their booklet from NCLEX, and I have it down below. It's a Google Drive, but you can download it from there, also in their website. It's for free everywhere. Just pop up some by yourself, make examples for each of them, whatever what comes in your mind, and you need to have like example 1 or 2 or 3 for each of them, and very fast, and then that you can see how fast you go. And I think this is one of the practice style. Here there are those 6 extra new NCLEX, and for 25. In 26, I think we're going to have more case studies regarding these. And I have a case study, as I said, about all of this, and also example what this means specifically for this chapter 59. So if we go by that candidate performance report, the CPR, with NCLEX domains, I counted here like 1 to 15, and you see I have example for management of care. So I have here 4 examples, like what to do, key nursing action for management of care, and red flag straps and priorities, same 3 of them, and then tools to memorize, like if we have anything to know about it. Like for safety and infection control, of course, it use standard precaution for all patients and transmission-based precaution, example, contact. Keep in mind it's indicated for infection hepatitis. So for tools to memorize, they have vaccination schedules, and keep in mind those ones. And then red flag, for instance, is like failing to educate family members on proper hand hygiene and prevention strategies, and assuming a patient with chronic non-acute hepatitis B or C does not require precaution. So these are red flags. Basic care and comfort, since majority struggle with this category. Administer medication and provide non-pharmacological intervention for pruritus, cold bath, moisturizing lotions, provide meticulous skin care for jaundice and edematous skin to prevent skin breakdown. Reposition patient with severe ascites, so it's like having abdomen very distended, it's fluid, to improve breathing and comfort. And here red flags, not providing non-pharmacological comfort measure. Here my probably the question might confuse with caregiver versus an RN here. Probably that's why it might be a little bit confusing. Forgetting to inspect skin folds and body prominences for skin breakdown. Daily abdominal grief, so keep this in mind, measurements, and daily weight to track fluid changes. So here, but also can be with management of care, kind of similar. Keep in mind, you don't delegate these to a caregiver, so kind of like this. So just there my little few examples, and also you can come up with many more examples from from every disease: hepatitis, liver cancer, cirrhosis. So this I just focus more on hepatitis. Continue down the list. Here, as you see, it's 6, 7, 8, 9. Pharmacological and parental therapies, reduction of risk potential, psychosocial adaptation. So you see I have again 3 examples. You can have 5, you can make more. Let's see, pharmacological, also it's huge on RN. Administer lactulose, keep in mind, to reduce ammonia, diuretics, IV albumin, keep in mind. Red flags here, it's administering the depressants and failing to monitor for electrolytes imbalance like hypokalemia with diuretic use, and to memorize like normal ammonia level. I have like playlist with all lab levels, and I know it's fast, but the fast you see it, then if you can read that fast, that means you know, you memorize it, you already know, you know. Normal range for electrolytes, so potassium, here with platelets, of course, the normal bilirubin, normal liver enzyme levels, so keep in mind the lab values. Here we are in the last part, and this is the new gen. I will have a case study about here. Here I have just 1 or 2 examples, but you can make your own, and keep in mind every time you need to evaluate. So this is kind of nursing management. When you administer lactulose, reassess the patient mental status and check if ammonia levels are decreasing. Even with the blood pressure medication or anything, even if you provide even wound care, is still bleeding or not, this is good or not. So here is that means evaluate. After fluid resuscitation for GI bleed, check if blood pressure has stabilized and heart rate has decreased, right? And falling to reassess the patient after an intervention to determine its effectiveness. So this is mandatory for everything you give for EDU for the patient. And now we go into the case study. Here is our patient. Here is the Next Gen NCLEX case study based on the patient Mr. Green from our textbook. This case study is designed to walk us through the entire clinical judgment measurement model in order. So the case study, I know I repeat myself so many times. Patient Mr. Green, 56-year-old male, admitted diagnostic liver failure, cirrhosis. We have 6 steps to complete the case study. Then we have 15 questions for each NCLEX RN domains. So patient came into the emergency room saying, I feel weak, no appetite, and I'm tired. So this is the chief of complaint why the patient arrived to the clinic. Then the nurse will check the history of our patient. Step 1, recognizing cue. Mr. Green is admitted with a history of IV drug use and chronic alcohol consumption. On assessment, you note the following findings. Which of the following assessment findings are relevant cues that indicate Mr. Green is experiencing liver dysfunction? In some case studies that like Kaplan, for instance, it will be like a paragraph, and you take the mouse and you just highlight certain findings. So here I have just like A, B, C, D, E, F, but in Kaplan, for instance, it's like just long paragraph. You just click, 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 you do this. So A, blood pressure, 145/90. Then you have scleral icterus, yellowing of skin. You have caput medusae, so it's visible veins on abdomen, pale clay colored stool, clear pale yellow urine, and spider angiomas on the chest. So correct answer are sclera, so the yellowing of eyes, the visible veins on the abdomen, pale clay colored stools, and spider angiomas on the chest. Why are those correct? Because the BD, so the yellowing of eyes and pale colored stool, so these jaundice and colored clay are caused by the liver inability to metabolize excrete bilirubin. The F, spider angiomas, are a classic sign of cirrhosis. So the caput medusae, so the visible vein on abdomen, is a sign of portal hypertension, shunting blood to abdominal veins. So note that the urine is typically dark amber, not clear in liver failure due to bilirubin, and blood pressure is often low, not high, in advanced liver failure due to fluid shift vasodilatation. Step 2, analyze cues. So you review Mr. Green's lab's results of platelets, 80,000 millimeter cubes, so it's low. PT, it's 18 seconds, prolonged. Ammonia, it's 95. Albumin, it's 2.5. Match the laboratory findings to the correct pathological explanation. So low platelets go with what? Prolonged PT goes with what? And high ammonia and low albumin. So the low platelets go with enlarged spleen, right? It's making sense here. Coagulation, right? And then the prolonged PT, it's with liver inability to synthesize the clotting factors. Then the 3, the high ammonia, it's liver inability to convert toxins. So, and then the low albumin, it's with liver inability to synthesize protein. So the portal hypertension causes the spleen to enlarge and destroy or trap platelets. The liver markers clotting factors. Failure leads to bleeding risk, so it's prolonged PT. The liver normally converts ammonia in urea. Failure leads to high ammonia and encephalopathy. The albumin is a protein made by liver. Low level cause ascites edema. Step 3, prioritize hypothesis. It is now day 2. Mr. Green is becoming increasingly confused. He does not know where he is, and he's trying to get out of the bed. His hands are flapping when he extends his arm as the takes. His abdomen is distended and tight, so he's getting sicker. Which complications is the highest priority for the nurse to address right now? Risk for infection, impaired gas exchange, risk for injury, volume deficit. Risk for injury. So while all are valid, the immediate safety risk is the patient's confusion and risk for false injury due to hepatic encephalopathy indicated by confusion and ascites. This requires immediate safety measure and treatment to lower ammonia. Generate solution. It's step 4. The healthcare provider prescribes lactulose for hepatic encephalopathy. What is the goal of this specific medication intervention? To kill bacteria in the gut that produces ammonia, to pull fluid from the tissue into the vascular space, to promote excretion of ammonia in the stool, to decrease portal pressure and prevent variceal bleeding. So we know that the main medication with liver is also lactulose, and keep in mind that what in here is related to liver, to promote excretion of ammonia in the stool. So lactulose, it's a laxative that traps ammonia in the gut and promotes in its excretion through the stool. So option A describe neomycin, an antibiotic often used with lactulose. Step 5, take action. You are preparing to administer the lactulose to Mr. Green. He's drowsy but arousable. Which nursing action is essential to perform while managing this patient? So what is your action? Restrict the patient's protein intake to 0 gram immediately. But why? Monitor the patient for 2 to 3 soft bowel movements per day. Keep the patient in supine, flat position to prevent falls. Administer ibuprofen for any headache complaints. So the correct is the monitor the patient for 2 to 3 soft bowel movements per day. This indicates the medication is working effectively, so clearing ammonia without causing excessive dehydration, diarrhea. So the option A is incorrect because protein is generally not strictly restricted anymore unless encephalopathy is severe and are responsive. Our patients are malnutrition. The C patient with ascites should be in high fallers to help breathing. The D option, it's incorrect because the ibuprofen NSAIDs should be avoided due to bleeding risk. Last question, evaluate outcomes. It's day 4. You're evaluating Mr. Green's response to the treatment plan. Which finding indicates that the treatment plan has been effective? The patient reports that his stools are now hard and formed. Patient is alert and oriented ×4 and can write his name legibly. Patient abdominal grid has increased by 1 centimeter. Serum ammonia level is 110 micrograms per deciliter. I think makes sense because it indicates the treatment has been effective. So this looks like it's the most effective. The primary goal of treating encephalopathy is improve mental status and motor function. The ability to write legibly, it's a common test for Ascites coordination. So 110 is still high, normal is between 10 and 80. So now I will show you my case study. Here is the case study of Mr. Green, like as the step 1 when we have the question to recognize the key. You see here on the abdomen and the eye and also the belly, it's distincted. The step 2, analyze the cue. You look over the labs. Then 3, he was at the fall risk and confusion, so he got sicker here. The doctor prescribed the lactulose, and this is the generate solution. And then step 5, take action. You administer lactulose, you monitor the stools, and on the day 4, we evaluate so he can write his name and he's more orientated. It says ×4. Now we have 15 questions, 1 question per each domain. From that, the candidate performance report. So let's see here on our chapter 59, patient with hepatic disorders, how management of care question type can be. A nurse is coordinating care for a patient newly diagnosed with cirrhosis. The patient has a history of alcohol use and is currently stable. So looks like our little bit like our patient, a bit different. Which of the following interprofessional team members should the nurse prioritize for consultation? So now you take care of this patient, but you need to have a consultation with other departments. Wound care specialist, physical therapist, registered dietitian, palliative care team. Registered dietitian because we have a patient with cirrhosis to establish a low sodium and appropriate protein diet. Dietary management is crucial to prevent complications like ascites and hepatic encephalopathy. While other consultation may be needed later, dietitian is essential for immediate ongoing management. So the text says the chapter emphasizes that for cirrhosis, care includes to designate a plan of care that includes dietary consideration. It specifically notes intervention to restrict sodium, restrict protein intake if encephalopathy is a risk, and provides more frequent meals. So the text confirmed that the diet is a major component of management for ascites, the low sodium, and encephalopathy, the protein management, making the registered dietitian the priority consultation. Question 2, we have for hepatitis. The NCLEX domain, safety and infection control. A nurse is caring for a patient admitted with active hepatitis A. Every time when it's itis, it's inflammation. So always think that will be a question for safety and infection control because it's inflammation. So can be viral, can be bacterial. So how you prevent this? The patient is incontinent and disoriented. What is the most crucial nursing action to prevent the spread of virus to other patients and staff? So what? Administer a hepatitis A vaccine to the patient using N95 respirator mask during all patient care, ensuring strict hand hygiene after removing gloves, limiting the number of visitors the patient can have. Correct answer is hand hygiene. So you need hand hygiene after removing gloves because hepatitis A is primarily transmitted through the fecal oral route. The most critical action to prevent the spread is strict hand hygiene, especially after contact with patient who is incontinent. The virus can be transmitted through direct contact and with infected fluids or objects, so hand washing is essential. With everything, it's good to wash your hands. Even if you go outside, pick up your mail and bring it back for your own, it's better to wash your hands. It's not just you need to memorize that hepatitis A, I need to have gloves. In this question, it says the patient is incontinent. So you need gloves and hand washing before and after. And so the text says hepatitis A. The text states that is spread through the fecal oral contamination. So the nursing intervention explicitly state that practice good hand hygiene before and after eating and after using the toilet to decrease transmission from the fecal oral route. But the more hand hygiene, the better it is. Question 3, topic cirrhosis domain, health promotion and maintenance. So here the nurse is providing discharge teaching to a patient with cirrhosis who has been managed for ascites. Which of the following statements of the patient indicates for further education? So all that are correct, one needs further education. A, I need to avoid drinking alcohol completely. I should weigh myself every day to monitor my fluid status. I'm feeling bloated. I can take over-the-counter ibuprofen for relief. It's important for me to take my diuretic medication every morning. Correct answer is patients with cirrhosis should avoid all NSAIDs like ibuprofen or acetylcholine because they can worsen kidney function and increase the risk of GI bleeding. The other options, avoiding alcohol, daily weight monitoring, and taking diuretics, are correct and should be part of the teaching plan. So taking ibuprofen as needed for further education. So the standard NCLEX knowledge. So this is correct because the NSAIDs increase bleeding risk, varices, and can harm kidney. So hepatorenal syndrome. So the chapter text specified that educate about medication. It says also like such as acetylcholine and avoid any medication that is toxic to the liver, such as acetylcholine, but doesn't say to forbid NSAIDs in the cirrhosis section, and actually lists NSAIDs as the pain intervention in the liver cancer section. So I think here it's a little bit confused, but keep in mind that uh, all these three looks like correct, and this look a little bit questionable. So that's why it's incorrect. Question 4, liver cancer. Domain, NCLEX domain, psychosocial integrity. A patient with a new diagnosis of advanced liver cancer says to the nurse, "I don't understand why this is happening. I've always been so healthy." The nurse's best response is, "I'm sure you did everything you could to stay healthy." It sounds like you are feeling confused and upset about this diagnosis. Liver cancer is often caused by long-term inflammation and can happen for many reasons. Let's focus on your treatment plan and not dwell on the past. Correct answer is, so it sounds like you are feeling confused and upset about this diagnosis. So the best response uses therapeutic communication to acknowledge the patient's feelings. It reflects the patient's statement, validates their emotional state, and opens the door for further discussion. This promotes psychosocial integrity by supporting the patient's emotional well-being. So the text support identifies risk for ineffective coping as a nursing diagnosis for liver cancer. So option B is the only response that addresses the psychosocial need, so coping, rather than dismissing feelings or offering false reassurance. Question 5, for cirrhosis, NCLEX domain, basic care and comfort. A nurse is caring for a patient with severe cirrhosis who complains of intense itching, so that is pruritus. Which of the following nursing intervention will be most effective in providing comfort? Administering a PRN dose of Naxolone, applying a warm compress to the affected areas, keeping the patient's fingernails short and clean, giving the patient a hot shower to relax. So the correct answer is keeping the patient fingernails short and clean. But this also can be not just basic care and comfort, but also here the clean is like safety too. Pruritus in cirrhosis is caused by the bile salts accumulating under the skin. Keeping the patient fingernails short and clean is critical nursing action to prevent the skin exoration and secondary infection for scratching. Warm or hot showers and compresses can actually worsen the itching by causing vasodilation. Naloxone is an opioid antagonist and is not indicated for this purpose. In our text, notes the pruritus caused by accumulation of bile salts, and lists impaired skin integrity as a nursing diagnosis. So while the text doesn't explicitly write cut nails, it links pruritus to skin integrity issues. Keeping nails short is the standard nursing intervention to prevent the impaired skin integrity mentioned in the text. Question 6, we're still in cirrhosis. NCLEX domain, pharmacological and parental therapies. The nurse is preparing to administer lactulose to a patient with cirrhosis and a new onset of confusion. The patient ammonia level is 85 and the nurse understands that this medication is effective when which of the following is observed. The patient blood pressure increases, the patient abdominal grease decreases, the patient mental status improves, the patient reports a decreased pruritus. So we give lactulose and to improve for the mental status because lactulose is a laxative that works by pulling ammonia from the bloodstream into the colon to be excreted, thereby lowering ammonia levels. An improvement in the patient mental status is the primary indicator that the medication is effectively treating hepatic encephalopathy. So in our text states that the lactulose promotes the excretion of ammonia in the stool accumulated toxin, ammonia causing changes in mental status. So in our rationale, the test directly links ammonia levels to mental status and encephalopathy, confirming that improved mental status is the sign of effectiveness. So here can be also like evaluate outcomes, right? Question 7. We are in liver trauma, NCLEX domain, reduction of risk potential. A patient has been admitted with blunt liver trauma after a car accident. The nurse is monitoring the patient for complication. Which of the following would be a priority red flag indicating a potential for life-threatening complications? So you are an ER nurse now, and this patient that is in your care just came in after a car accident. So now you think about the priority red flag that indicate this potential of life-threatening. So it's sick and get sicker. So don't get sicker and sicker. Change in the patient blood glucose. The patient abdominal grease decreases. The patient hemoglobin and hematocrit values drop. The patient reports mild abdominal pain. So the patient hemoglobin and the hematocrit values drop. So think that this is blood related, this is liver trauma after car accident, and these values drop. So a liver is highly vascular, and liver trauma can lead to a significant internal bleeding. A drop in hemoglobin and hematocrit is a critical red flag for active bleeding and potential for hemorrhagic shock, which is a life-threatening complication. So think ABC. So you have bleeding and circulation. So our textbook states the hemorrhage is the most common cause of death. Risk of hemorrhagic or hypovolemic shock is high. It lists several hemoglobin and hematocrit as a key assessment. So a drop in those labs value indicates the continued internal hemorrhage mentioned in the text. So labs is very important to keep eye on them. Question 8. Liver cancer, NCLEX domain, psychosocial adaptation. A patient with a history of hepatitis C develops liver cancer and is experiencing an acute decline in function. The nurse recognizes that the major role of the liver is to promote clotting factors. The nurse, my dog, the nurse should be most vigilant for which of the following signs? Elevated blood pressure, bleeding from the gums or nose, decreased serum keratin, peripheral edema. So think about hepatitis C, liver cancer. Bleeding from the gums or nose, the liver synthesizes clotting factors, including prothrombin and factors 2, 7, 9, and 10. When the liver's function declines, it can no longer produce those factors, leading to a risk of hemorrhage. Bleeding from the gums or nose is a sign of this complication. In the book defines the liver function as the synthesis of clotting factors. Under assessment, it lists bleeding gums, ecchymosis, so bruising, epistaxis, so it's the nosebleed. Complication of decreased clotting factors. So bleeding is the direct clinical manifestation of the liver's failure to produce clotting factors. Question 9, cirrhosis. NCLEX domain recognizing cues. The nurse is assessing a patient with a history of alcohol use and notes the following cues. Scleral, isterus, abdominal distension, and a flapping tremor of the hands. What is the most relevant information to identify from those cues? A history of hypertension, a recent head injury, signs of advanced liver disease, an allergic reaction to a medication. So it's obvious that it's sign of advanced liver disease. So the cues of sclera, so the jaundice, the yellowing eye, abdominal distension, and flapping tremor are all classic signs of advanced liver disease, such as cirrhosis. Recognizing those cues, it's the first step in clinical judgment process to identify the patient underlying condition. Question 10, cirrhosis, prioritized hypothesis. A patient with cirrhosis has a new onset gastrointestinal bleed. The nurse identified the following hypotheses for the patient's care. Which of the following should the nurse prioritize first? Administer lactulose to manage the patient ammonia levels. Managing the patient's pain and discomfort, stabilizing the patient hemodynamic status, promoting emotional support to the patient family. So the correct answer is stabilizing the patient hemodynamic status, because in a patient with acute GI bleed, the immediate priority is to stabilize the patient hemodynamic status to prevent hemorrhagic shock. While other actions are important, they are not life-threatening though. The nurse must prioritize based on urgency and risk. So in our book says that esophageal varices may result in upper GI bleeding. For liver trauma, hemorrhage, it's prioritized hemodynamic monitoring for shock. So hemodynamic stabilization is the priority intervention for any patient with active hemorrhage, so the bleeding varices, aligning with the text focus on shock management. Question 11, so we have to 15, so 5 more. Liver trauma, NCLEX domain, clinical judgment. A patient arrives at the emergency department, ER, after a motor vehicle accident with blunt trauma to the abdomen. Initial vitals were stable, but 1 hour later, the nurse noted that the patient was anxious, cool to touch, and had an increased heart rate of 116 beats per minute. Based on clinical judgment of this changing situation, which complication does the nurse prioritize as the most likely cause? So, gut seeker, post-traumatic liver abscess, bile duct laceration, hemorrhagic shock, diaphragmatic tear. So it's hemorrhagic shock, while all options are potential injuries from liver trauma, but the text states that hemorrhage is the most common cause of death, and the risk of hemorrhagic or hypovolemic shock is high. The symptoms of anxiety, alternate level of consciousness, cool skin, tachycardia are the specific clinical manifestation of shock listed in the book. Question 12, cirrhosis. NCLEX domain analyzes cues. The nurse is analyzing assessment cues for a client with advanced cirrhosis. Which of the following cues would the nurse identify as specific indicators of stage 2 hepatic encephalopathy? Select all the apply. Flapping hand tremor, coma, sweet fecal breath smell, disorientation and agitation, violent behavior. So the first option is Ascites, the factor hepaticus, disorientation and agitation. So all these, according to the table 59.5, stages of hepatic encephalopathy, stage 2 is characterized by increased drowsiness, disorientation, agitation, as well as Ascites and factor hepaticus. Coma is stage 4. Violent behavior is not specifically listed in the stages provided in the textbook. Question 13, hepatitis, NCLEX domain generates solution. A nurse is generating a plan of care for a patient newly diagnosed with acute hepatitis B, who reports severe fatigue and anorexia. Which intervention should be included in the plan? Encourage large high-protein meals twice a day, cluster nursing care to promote rest periods, advise the patient to avoid alcohol completely, administer acetaminophen for fever and body aches, encourage small frequent meals. Cluster nursing care to promote rest periods is correct. Advise the patient to avoid alcohol. Encourage small frequent meals. So this is generating solution. The text explicitly states to promote balance between physical activity and rest and promote small frequent meals, because the liver cannot store glycogen well at this moment. Alcohol must be avoided. It is hepatotoxic. Acetaminophen, it's a tricky distractor. The text explicitly warns to avoid any medication that is toxic to the liver, such as acetaminophen. Large meals are incorrect because the patient has anorexia and feelings of fullness. Question 14, esophageal varices and the cirrhosis. NCLEX domain, take action. A patient with a cirrhosis has this Blackmore tube, Sengstaken Blackmore tube, in place to control bleeding varices. The patient suddenly develops severe respiratory distress. What is the priority action the nurse must take immediately? Page the healthcare provider, use scissor to cut the tube, increase the inflation of esophageal balloon, place the patient in a high failure position. So the correct answer is use scissors to cut the tube, because this is a safety crucial action. The text warns that the tube can migrate out of a stomach and cause airway obstruction. The specify safety alert instruction: scissor should be kept at the bedside for emergency use, which implies the action is to cut the tube, to deflate the balloons immediately to clear the airway. ABC, right? So that's priority. We're at the last question. Yay! We made it. We're in cirrhosis, NCLEX domain, evaluate outcome. A patient with cirrhosis and severe ascites has been receiving diuretic therapy and albumin. The nurse evaluates the outcome of this intervention, which findings indicate the treatment has been effective. The patient reports decreased short of breath, abdominal breath measurement have decreased, the patient's blood pressure has increased significantly, serum ammonia levels have dropped to the normal range. Weight loss is observed on daily weight. So the correct answer is the patient reports decreased short of breath. We like that because it's evaluate outcome. Abdominal girth measurements have decreased. We like that. Weight loss is observed on daily weights. So these are the correct answers. The text notes that ascites causes short of breath due to pressure on the diaphragm and increased abdominal girth. Therefore, effective treatment will result in decreased girth, weight loss, fluid removal, and improving breathing. Ammonia levels relate to encephalopathy, not directly to ascites, fluid removal. A significant blood pressure increase is the primary goal of diuretic therapy, which lowers volume. The albumin maintains volume. The primary indicator of ascites reduction are girth and weight. So this is the last question. I hope that by reviewing this video helped you have understand how the NCLEX is asking you what to do about patients with hepatic disorders, and using this candidate performance report as a guide, and that case study. I hope that helped you little bit or little bit more. Tell me, let me know, and good luck with your NCLEX preparation, and see you in the next video. Thank you and bye for now.
We finally made it! Thank you again for your time and trust. I'm Mia, and from my heart to yours. Until next time, stay sane, stay grounded. Namaste. Bye for now.